Hey everybody, Dr. Dave Marquis here again, and I wanted to take a moment to share with you some of the things that are on my mind and hopefully instill a little bit more optimism and continue that ever-present hope that I want everybody to hold on to. There's been some questions that have been posed to me about some of the things that I've recommended previously, and I thought that it would be useful to perhaps address those, because if one patient has that question, usually there's a half a dozen others that do as well. One of those was in regards to nebulized hydrogen peroxide, so I wanted to answer that question publicly so that everyone could hear about that. And well, I'll just dive in with that one first. So there's a handful of things that I've recommended, and if you watched any of my videos, then you're aware of them. There's a handful of things nutritionally that help to dismantle viruses and optimize your immune neutral state. So you got your vitamin A, your C, your D, your zinc, and your glutathione. Those are some of my absolute favorites. I encourage everybody to have those on hand, and I've talked extensively about those in other videos. Utilization of ozone in both drinking ozonated water as well as rectal application with suppositories or even the gas. I've talked about that, and I encourage people to become aware of the utility of that tool. And then the nebulized hydrogen peroxide. So I'm going to take just a second and kind of expand on that one. If you have a nebulizer, then you understand that you're basically taking a liquid and you're turning it into micronized vapors that you can then inhale, and it will deliver whatever it is that you're nebulizing into the respiratory system, and then it goes systemically via the bloodstream. So hydrogen peroxide has a number of amazing uses, and it's been around in medical use since the late 1700s. Yes, that's right, 1700s. So we've been utilizing this stuff safely in the field of healthcare for well over 250 years now. And most people don't even realize many of the applications that can be readily accessed by any human being that can walk into a store and pick up some hydrogen peroxide. So let me detail that for you. I mean, it was in competition with mercury, for Pete's sake, back in the day. And you know that you don't want to use mercury, but that's how old it is, in other words. It really didn't fall out of usage for any good reason other than the advent of antibiotics. And when antibiotics came to be readily available, they just naturally stopped using that which was free, or virtually free. Does not mean that it's any less effective. And so the utilization of hydrogen peroxide in a nebulized form has proven to work really, really well for upper respiratory infections. So much so that I have numbers of colleagues here in California that are actively seeing some of the COVID patients with active COVID, where they're actually having blood in their sputum, some lung particles coming up, and they're actually able to utilize nebulized hydrogen peroxide to effectively treat this and turn those cases around. I know this personally now. Not here in this office have I seen it, but in some of my colleagues that have treated those patients. So seeing that it's effective even in those later stages, and knowing that it's effective as a preventative measure, it would behoove anybody that has any inkling of concern relative to their upper respiratory tract to just know that information. So there's a number of videos online that people can go to for directions on that. I know Dr. Mercola actually put one out about a week ago, and it was a nice tutorial. But in essence, you're looking at about a 3-part mixture of water to 1 part hydrogen peroxide to start with, and then you can go down to a 1-to-1 ratio. It doesn't take a lot of volume. Basically, you're filling that container, which is roughly the size of a sacrament cup of water, and you're making that ratio of water to hydrogen peroxide, and you turn the unit on, and you'll see a vapor stream come out. And then you simply breathe that vapor stream in and allow it to get seated in the lungs, and then you breathe out normally. It's simple, and it's very effective. I've personally used that for a number of upper respiratory infections over the years, and it's proving to be very effective for this one as well. Next area that I wanted to touch on is that we collectively need to not participate in social shaming. I've seen so many people get into a finger pointing and an accusatory state of mind, which really does some negative things for us as fellow human beings. If you've ever looked at the field of psychoneuroimmunology, you know that those things that you're thinking and speaking can become reality the more that you focus on that and give it energy. So if we're focusing on and giving energy to negative things, those things actually start to become reality to us. We can use that same field of psychoneuroimmunology to our benefit by focusing on those things that we want, those things that we want to see happen, and actually speak as though that is the environment. This isn't airy-fairy stuff. This is hard science that we can actually change our immune response by the way we think and speak. So I would encourage everyone to keep that positive mental paradigm and know, as I've been saying all along, we're gonna be just fine. Still believe it today, believed it last week, and I'm gonna believe it tomorrow. Because that is my mindset, it's my reality, and I believe that each of us are in charge of our own reality and what we create with that. It doesn't mean that we're not going to have obstacles. It doesn't mean that we're not going to have hard times. I mean, for Pete's sake, somebody decided to break into my office last week, bust out 2 monster windows, and steal 5 of my computers. It did not set me back. I mean, it'll set me back financially a little bit, but you know what? I can come to work tomorrow and still have the positive frame of mind and still give 100% of my energy to my patients. And I believe that every human being needs to do that. And my honest feeling at that time was, I hope the guys that stole those things needed it more than I did. And if we can just be positive and despite our circumstances and keep pushing through, you will, I will, we will succeed. So that's my message for this moment. What I'd like to do now, this will probably be a 2-part thing, because I want to take you guys through part of my office and show you some of the things that we have to offer here and some of the services that we have. But I want everybody to just know some of those things that I mentioned about the ozone, the hydrogen peroxide, the nutrition, and keep your mindset positive. Thank you.